We're here today for the next hour on RHI Giving Day, and this hour is sponsored by the Alex Crouch Memorial Fund. My name is Peter Bisbecos. I'm the Executive Director for Neuropsychology and Resource Facilitation, and I'm here today with Kim Woodard. Kim, would you like to introduce yourself and tell the audience what you do?
Yeah, so I'm the Nursing Professional Development Manager here at RHI, and I help with onboarding all of our new nurses and our nursing rehab techs, and I help with just ongoing competency management and validation, and just serve as a consultant to advocate for the nurses for different committees throughout RHI.
That's quite a lot you got going on.
Yeah.
And in that role, you use a software product called MedBridge, don't you?
Yeah.
Could you tell us about MedBridge?
Sure. Yeah. So MedBridge is a evidence-based education platform that offers continuing education courses for both nursing and therapy disciplines. It also has great patient education resources and home exercise programs. It's a web-based program, and it also incorporates apps both for staff education and patients to use for home exercise programs. So it's really easy, accessible, which makes it really nice.
And how long have you guys been using MedBridge?
So nursing's been using it for 2 years now. Therapy jumped on board a little bit earlier than that. It was initially built for therapy, and then they recently added some acute rehab nursing specific content, which is really nice because it incorporates rehab knowledge that can help nurses gain specific content specialized in their area. So they have spinal cord injury, brain injury, and then all different kinds of like stroke education built throughout. So it really helps with staff development, which also in turn helps with better patient care and outcomes.
So before we had MedBridge, how did you guys do education?
Well, we supplement that now with orientation and just ongoing staff development. Before then, we used a learning management system called Elsevier, which we still supplement that for clinical skills because it gets updated with evidence-based content, but it didn't have any continuing education hours. So it really helps support professional growth, and there wasn't an opportunity to help prepare nurses for the certification rehab exam, and that's really nice for rehab nurses to get, and it's called CRRN. So MedBridge incorporates that prep program, and we have a 100% pass rate since we've utilized that, and I actually got mine last December, so I can attest to that, and it just really enhances your knowledge base and makes you a better clinician, which again turns into better patient care.
So the one-stop shop makes a difference when you're training and getting certification.
Oh yeah, it's a complete package, and it really helps support growth in the organization and helps our patients. Yeah.
Have you gotten feedback on MedBridge over the last 2 years?
Oh yeah, great feedback from nurses and both techs. I can't speak specifically to therapists, but I do know therapists really enjoy it, and patients really like the patient education. And then with the app that the patients can utilize with the exercise programs, instead of getting those printouts that therapy likes to give patients, just written material, they are engaging videos that display the certain exercises, which is really nice.
And having been one of those patients myself, recovering from a knee operation 2 years ago, I can tell it's much nicer than the old-fashioned way of doing it, where you get the piece of paper that's been photocopied about 25 or 30 times. It's hard to see, and it's an inanimate object. So that, even though this is your interview, I just want to add that was a wonderful tool, and certainly helpful from a patient perspective.
Yeah.
So you all are glad to have MedBridge, and it's made a positive difference.
Oh yeah, it's a great support. It's wonderful that the donors have provided that support for RHI staff. It's even from a professional standpoint, having an organization to support education in that regard, because things like that are not cheap. So it takes a lot to invest, and whenever an organization supports education, I think it speaks volumes to that. And then also it helps reiterate the importance of research, because it does incorporate evidence-based content, and it makes sure that we are staying on top of what's best practice.
Can people go back and re-reference their training on MedBridge if they can't remember something?
Yes, it's it's really easy to go back, and it's also easy as an administrator to track education to see who's done what, And then if staff go above and beyond, they can incorporate that in like their evaluations to say, I wasn't mandated to do this specific education, but hey, I really wanted to enhance my own knowledge on my own time. And I think that also speaks volumes from a clinician standpoint and then their manager as well.
So the donors made a significant difference in helping us get and keep MedBridge.
Absolutely, yes. Staff development, better patient care, better patient outcomes. So it's been a huge support, and we're very thankful for that.
Well, thank you, Kim, and thank you to the donors. And for those of you who want to know more about the Alex Crouch Foundation, there is a link that will be attached at the end of this interview.
Thank you.